Hello, I'm Brad Marino. I'm the Executive Co-Director of the Pediatric and Adult Congenital Heart Center at Cleveland Clinic, the Chair of Cardiology and Cardiovascular Medicine at Cleveland Clinic Children's Hospital, and the Executive Co-Director of the Neurodevelopmental Support Program at the Cleveland Clinic Children's Hospital Rehabilitation. And I'm one of the co-chairs of this very important scientific statement.
Hi, I'm Erica Sood, and I'm a pediatric psychologist at Nemours Children's Health and director of the Cardiac Neurodevelopmental Follow-Up Program in the Nemours Cardiac Center. I am also a co-chair of this important scientific statement. Why should we be concerned about neurodevelopmental outcomes in individuals with congenital heart disease?
Congenital heart disease is the most common birth defect. And we realize that children who have had congenital heart surgery earlier in their lives are at significant risk for white matter injury that may impact them in very important ways from a neurodevelopmental standpoint. Those areas include issues with attention, issues with processing speed, working memory, visual motor integration, executive functioning, fine and gross motor skills. And we know that these issues really significantly impact their social functioning and ultimately their health-related quality of life.
I agree. Neurodevelopmental deficits in individuals with congenital heart disease can have a huge impact. Not only do they impact the individual, but they impact the family. So in 2012, you were first author on the original scientific statement about neurodevelopmental outcomes in children with congenital heart disease, and that contained the first ever guidance for healthcare professionals and patients and family members and other stakeholders about the importance of evaluating and monitoring and intervening on neurodevelopmental outcomes in children with congenital heart disease, and provided guidance on how to identify which patients are at highest risk.
Being the first author for the statement in 2012 and now partnering with Dr. Sood to be the senior author on the new statement in 2024 has really been transformative. It's been transformative for our patients and families. It's been transformative for our hospital systems and for our care providers that minister and care for this huge population of children, these survivors with congenital heart disease. Being able to work with families when their babies are fetuses, and then in childhood, adolescence, young adulthood, and know that we have the teams now to help and assist these children achieve their greatest educational capability, social capability, and become important members of our communities it's really, really special. And having the ability to work with some of the thought leaders in this area in the United States to write this second statement has really been one of the true privileges of my career.
Compared to the 2012 scientific statement, providers and caregivers are asked to sequentially review 3 risk categories. Risk category 1, which is history of cardiac surgery with cardiopulmonary bypass during infancy, and risk category 2, which is history of chronic cyanosis, are unchanged relative to the 2012 scientific statement. One of the evolutions to the new statement and the algorithm is the changes to risk category 3. Risk category 3 now has 2 criteria. The first is intervention or hospitalization secondary to congenital heart disease during childhood or adolescence, and the second criteria is 1 or more factors that are known to increase neurodevelopmental risk. Category 3 is intended to identify those individuals where their developmental delay or disorder could have been a result of their congenital heart disease or related to their congenital heart disease. There are also new sections on emerging risk factors and promising neuroprotective strategies.
There are 4 major areas of neuroprotection highlighted in the scientific statement. The first area is fetal and perinatal neuroprotection. We want to diagnose every child we can with congenital heart disease during the fetal period. So this way they can be delivered as close to term as possible, which we know is neuroprotective. And then if they have a congenital heart defect that will require a specific intervention right after birth, these babies can be delivered in quaternary pediatric congenital heart centers that have access to surgeons, catheterization labs, so that these babies right after birth can have these critically life-saving interventions. Erica, the second area of neuroprotection is in surgery and the perioperative period. It's critically important that we time the surgery that these newborns are having at the exact time that's going to allow any secondary organ damage that has occurred during the child's birth and first couple of days of life to resolve, but not wait too long that then puts the brain at risk potentially. It's critical that we have a technically perfect operation to protect the brain. We want to minimize the deleterious effects of cardiopulmonary bypass, and then we want to ensure cerebral perfusion and brain oxygen delivery.
Third area of neuroprotection is in-hospital neuroprotection. That includes providing developmental care interventions in the hospital for babies who have to spend sometimes weeks or even months in the hospital setting, which we know can negatively impact their neurodevelopment in the long term. It's also critically important that we support parents in the role as primary caregiver, because they're the primary caregivers for their babies. Lastly, we need to ensure access to habilitative services like physical therapy, occupational therapy, speech and feeding therapy in the hospital setting to promote long-term neurodevelopment. The fourth area of neuroprotection is supporting transition from hospital to home. This includes an assessment of post-discharge needs, including neurodevelopmental needs, and providing care coordination to ensure that families are accessing and have the support to obtain the services that the child needs.
Can you comment on the specific developmental assessments recommended for individuals with congenital heart disease?
This scientific statement provides information about key domains for age-based developmental evaluation, including birth to age 5, school age and adolescence, and adulthood. We recommend that readers refer to the Cardiac Neurodevelopmental Outcome Collaborative age-specific domain assessment guidance. As developmental expectations change over time, new difficulties can arise, warranting repeated developmental evaluation throughout school age, adolescence, and into adulthood. Based on this new scientific statement, what is required to meet the neurodevelopmental needs of the high-risk congenital heart disease population?
Critical policy changes at the institutional, state, and federal levels are required to minimize barriers to accessing neurodevelopmental services and to ensure sufficient funds for cardiac neurodevelopmental research. Neurodevelopmental research and clinical care must be prioritized over the next decade to improve the neurodevelopmental outcomes and health-related quality of life of individuals with congenital heart disease across the lifespan. I think one of the really unique aspects of the new scientific statement is, as we've looked at the scientific literature for the last 10 years, we've come up with some really new, unique risk factors for neurodevelopmental delay or deficit, and we now have some neuroprotective strategies from the literature which didn't exist back in 2012. And I hope that the readers of this statement can really hone in and bring into their practice an understanding of these new risk factors, and as they can, implement the neuroprotective strategies to prevent or mitigate brain injury in this very high-risk population.
And one important difference is the addition of psychological distress in the parent and socioeconomic disadvantage as key factors that we know increase neurodevelopmental risk. And those were not included in the original scientific statement.
Erica, while the scientific statement was written for providers and caregivers, I think it's really important that parents in our community read this statement. While it is not necessarily meant for lay readers, I think most parents can read this and really glean a lot of important information that will empower them to better partner and collaborate with their care team for their child to allow the child to survive and thrive.
I would also add that because one of the differences in this new scientific statement is that we're also thinking about that transition to adulthood and the early adulthood years and what those neuropsychological needs may be at that time, that it's also important that patients read this statement and think about how it applies to them and the services that may be helpful for them. Thank you for listening to our discussion on the new scientific statement on neurodevelopmental outcomes in individuals with congenital heart disease. I'm Erica Sood.
And I'm Marino.